Hi, everybody. Thank you for expressing interest in the Bachelor of Environmental Public Health program at Conestoga College. My name is Ken Diplock. I'm the program coordinator for the Bachelor of Environmental Public Health. Today, I want to take a few minutes to give you a virtual overview of our program. So you bear with me, I'm going to share a quick presentation with you. So the Bachelor of Environmental Public Health at Conestoga College is what we like to call a degree with a difference. It is only one of 6 programs accredited by the Canadian Institute of Public Health Inspectors, meaning that our graduates can seek to become certified public health inspectors and work anywhere in Canada once they've graduated. We have an exciting group of faculty with lots of experience for you. So this is a list of our full-time faculty, starting with our Chair of Informatics and Health Science or Life Sciences, Kurt Monk. Kurt is a certified public health inspector, has his master's in health studies, and actually teaches in the program as well as being our chair. Myself, again, is Ken Diplock. I'm your program coordinator. I have a PhD in public health and health systems, and I'm a certified public health inspector. We also have Kathy Egan, who is currently in the midst of completing her PhD, as well as holding a master's in business admin, certified infection control practitioner, and also a certified public health inspector. We also have Wendy Pond, who holds a PhD in epidemiology and is a certified public health inspector. And last but not least is Dr. Ulysses Klee, who puts our E in environmental public health. And he is a certified toxicologist and has extensive experience in environmental toxicology and consultation in the private industry. So I want to take a few minutes to talk about the program design and what we try to do and accomplish here at Conestoga College. So our program is designed to provide a bridge for our students to a rewarding career in environmental public health. Quick snapshot of what our 4-year program looks like. We start in year 1, building professional knowledge and engaging students in the field of practice. We have our foundational programs such as human biology and applied microbiology, environmental science, and then we build on that and start to introduce students to the field of practice when we talk about emerging issues at a global and local concern, intro to environmental health, talk about health information science and the use of technology to help solve problems. And then through years 2 and 3, we start to build on those foundations, building our professional competencies, and gaining a full understanding of the scope of practice. So you'll see courses there, safe water, recreation. So that's looking at swimming pools and spas, bathing beaches and things like that. Environmental toxicology, environmental public health law, the built environment, waste management. We get into food science and food safety, epidemiology, advanced toxicology, infectious diseases, and infection prevention and control. And finally, we get to our culminating year, year 4, where we put that all together and we start to develop emerging environmental public health professionals. So we look at risk assessment and risk analysis, air quality, emergency preparedness, public health policy, and our students will also complete a research course in their final year based on an environmental public health related issue. What is environmental public health, you might ask? Well, one way we like to look at it is what we're learning to do. And what you learn to do in environmental public health is how to improve environmental health and reduce the burden of disease within the population, how to avoid getting potential toxins into our bodies, how to promote healthy behaviors, and how to make evidence-informed decisions. Now, the program here at Conestoga College, our Bachelor of Environmental Public Health, what this outlines is our graduate capabilities. So our graduates will come out with a knowledge of environmental public health, both science and practical, the systems and critical thinkers. They'll be able to influence behavior change and learn some of the models and ways to do that. They'll be able to have good communication skills and well-practiced in risk assessment and risk management, and proficiency in the use of technology, especially those related to their field of practice. And the program, again, has been designed based on, or in order for it to meet the public health core competencies. So these are a set of competencies that are developed that were identified as critical for all levels of public health, for everybody working in the public health sector. So we use those as a starting point. And we also use the Canadian Institute of Public Health Inspectors professional competencies in the development of our program. And that's what allows us to be one of the 6 accredited programs. If you want to make a difference, think about a career in environmental public health as an environmental public health professional. If you've seen the news lately, environmental public health is front and center as we deal with this unprecedented COVID-19 outbreak. So alongside medical practitioners, nurses, and others are environmental public health professionals working to protect the safety of the public, track the disease, prevent the spread of disease, promote good hygiene practices, environmental cleaning, and investigate the illness to try to prevent its spread. Traditionally, the most common role that environmental public health professionals work in is what we would call public health inspectors, or also sometimes known as environmental health officers, depending on where you work. And that's usually at the local level. But we have seen an emerging number of roles in the private industry for quality assurance, in food safety, environmental consultation, occupational health and safety, and so on. We like to say in our program that environmental public health professionals are jacks of all trades and masters of a few. So here's just a small list of many of the areas that environmental public health professionals traditionally provide service in. Some of the more common ones you may be familiar with are food safety, communicable disease control, drinking water quality. But as I mentioned earlier, also outbreak management is important, as we see with our COVID outbreak that's occurring right now. Also involved in personal service settings, so tattoo parlors, salons, hair places, things like that. Anybody that provides some of those services is working with them and providing education to make sure that they're doing things safely and preventing the spread of disease. So just a quick glance at, again, some of the roles of environmental public health to give you an idea of some of the things that you may be able to do after graduation. One of the common areas is in inspection practices. So here I've got a couple of pictures, one of meat inspection. We actually have a couple of our students, one on co-op and one recent graduate, that are currently out working for the Canadian Food Inspection Agency as part of their meat inspection program. Also here, the other picture is a picture of someone conducting a pool chemistry testing. So checking the chemical levels in the pool to make sure that the water is balanced, so it's comfortable for the bathers, but also that its disinfection levels are appropriate so that people aren't going to get a disease from the water. Building on that with safe water. So there's many areas we look at, from drinking water to injury prevention and disease prevention in swimming pools, as well as beach management and the safe use of our lakes, rivers, and streams. I mentioned this before as well. Infection prevention and control is a key area of focus, from sample collection to proper use of personal protective equipment to disease investigation. So trying to find out how diseases are spread and then what systems we need to put in place to prevent those spread. Outbreak management's a big area of focus right now, helping to coordinate quarantine measures, providing education to the public on what they can do for, hand hygiene, good hand washing practices, how to properly clean and sanitize surfaces, what protective measures they should take in different situations in order to prevent the spread. And that's, again, hand washing, hygiene, and sanitation. I talked about at home, but it's also an important role for environmental public health professionals to go into many facilities, childcare settings, hospitals, long-term care homes, retirement homes, and make sure people are following best practices. And again, I mentioned the personal service settings, so protecting the individuals getting the services, but also protecting the workers in that area to make sure that they're not at risk of exposure to diseases, in particular bloodborne diseases, because they're often penetrating the skin. So these are just some examples of the types of things that we do in environmental public health and the types of roles and responsibilities that you may have if you choose to become an environmental public health professional. And what we do at Conestoga College is we try to bring those experiences to life by engaging our students in applied practical experiences. And just this is a set of sample of many of those experiences that we've done in the class before. So we have our ladies all dressed in blue there. So learning how to don and doff, or put on and take off personal protective equipment properly. The next one is part of the end of, they were doing a hand hygiene audit. So checking hand washing procedures in a mock-up of a hospital. Then we have a mock inspection. So again, learning how to do an inspection of our little food premise that we have there. We have other ones doing or water chemistry at a splash pad. Some general work sharing information to the public. We have our hospital gowning situation there. So infection prevention and control, preventing the spread of disease, as well as some community work, working in a community garden, learning about food safety, food inequality, and food security measures. So just a little sampling of some of the things that we do to try to bring the curriculum to life and provide applied and meaningful experiences to our students. So one thing to note about our program is we are a tablet-based learning environment. So we do have our students use a tablet computer system. We do that, and we do that on purpose because we want you to be familiar with the technology that's used in the field of practice. So most practicing environmental public health professionals will use a tablet or a small computer when they're out in their field to collect notes, to share information, to provide education, to the clients that they're serving. And starting this fall, we are actually going to be offering a lease-to-own tablet computer program. So we will ensure that you get the right tablet. It'll actually be part of your tuition fees. You'll see that. Details will be provided at a later date, but the tablets will be provided to the students at the start of the semester, and they will be loaded with all the software that you need in order to be successful in this program. So that's kind of an exciting opportunity that we have, and something that's brand new for this fall. So again, we do feel that we offer a degree with a difference. It's a very exciting opportunity, and very timely, given what's happening now in the world. And if you'd like to learn more about the Bachelor of Environmental Public Health program and hear from some of our students, I would encourage you to check out the video posted on our program homepage entitled Conestoga's Bachelor of Environmental Public Health Program. Something we put together a couple years ago, and has some testimonials and overviews from some of our former students and recent grads who are out there working in the field as practicing environmental public health professionals. Again, thank you for your time. I hope you found this engaging and interesting and answer some of your questions. I'm happy to answer any other questions that you have. Feel free to contact me below. Again, my name is Ken Diplock. I'm the program coordinator for the Bachelor of Environmental Public Health, and you can reach me at kdiplock@conestogac.on.ca. Thank you and have a good day.